All right, let's get into it. Today, we're looking at a huge deal, the US government's game plan to weave artificial intelligence into basically every part of our healthcare system. And trust me, this is a plan that could completely change what a trip to the doctor looks like. But let's just start with this one kind of crazy question. Could an algorithm actually save your life? I know, it sounds like something straight out of a movie, but it is the fundamental promise driving this entire technological revolution. So this is what the Department of Health and Human Services, or HHS, is calling the next chapter for healthcare. They're picturing a future where AI isn't just a tool, but a core part of the system, sparking a total revolution from the moment you walk into the waiting room. And you can really see the difference here. On one side, you've got today's reality, right? The long waits, the clipboards with the same questions over and over, the one-size-fits-most treatments. But on the other side, that's the goal. A world with streamlined scheduling, no more paperwork headaches, and care plans built just for you. And this quote really nails the mission. This isn't just about cool new tech. The whole point, the entire strategy from HHS, is built around this one idea: making our healthcare system fairer, easier to access, and just plain better for every single American. So the big question is, how do we actually get to that future? Well, it's not just a bunch of ideas thrown at a wall. There's a real detailed playbook. So let's crack it open and look inside the government's official strategy for this medical revolution. The whole plan is built on these 5 key pillars. You've got to push for new research, for sure, but you also have to make sure the AI is used responsibly. Then you need to train people for these new jobs, build up the data infrastructure, and maybe most important of all, you have to protect patient privacy and security. Okay, you're going to hear this word a lot: interoperability. It sounds super technical, but it's actually a simple idea. Think about how the apps on your phone can all talk to each other. That's it. Right now, your doctor's office, the hospital, the lab, they all have their own separate systems that don't communicate. Interoperability connects them, giving AI the full, complete picture it needs to work properly. It's basically the lifeblood of this entire operation. So, how does all this strategy and planning actually look in the real world? Well, this isn't some far-off dream. AI is already here, in the exam room, and it's starting to change how we diagnose diseases and care for patients right now. And AI's impact is already incredibly wide. It's analyzing X-rays and MRIs to spot diseases way earlier than we could before. It's automating all that annoying admin stuff like scheduling and insurance claims. It's even in the operating room, helping surgeons with robotic precision. It's touching pretty much every part of healthcare. But let's zoom in on one of the most powerful uses, one that really gets back to that life-saving potential we talked about at the start: using AI to detect cancer earlier. So just how much of a game changer are we talking about here? Well, AI algorithms are getting scary good at this. They can analyze thousands of medical images and find those tiny, subtle signs of diseases like cancer, things that even a trained human eye might miss. We're talking about a level of accuracy that is truly revolutionary for early diagnosis. And it goes way beyond just diagnostics. AI is being used to slash the time it takes to discover and develop new drugs. It's creating personalized treatment plans based on your specific DNA. It's monitoring patients from their own homes using data from wearable sensors. It's even helping us track and predict the next big disease outbreak. The scale of this is just staggering. Okay, so this all sounds amazing, right? But with this much promise, there's always a catch. We have to balance all this incredible potential with some really, really significant challenges. This is a powerful technology, and we absolutely have to get it right. So let's start with the promise. The potential upsides are exactly what our healthcare system desperately needs. We're talking better outcomes for patients, bringing down those sky-high costs, and making sure more people can actually get the care they need, no matter where they live. But the road to get there is filled with some major roadblocks. We've got issues with bad data, the huge technical nightmare of trying to plug these new AI systems into ancient hospital software, and this thing called the black box problem, where sometimes we don't even know how an AI made its decision. Each one of these is a massive hurdle. Let's just focus on one of those for a second, because it's a big one: the risk of bias. See, an AI is only as good as the data you feed it. And if that data has, historical biases in it, maybe it underrepresents certain groups of people, well, the AI will learn those biases too. And that could lead to seriously unfair or unequal care. Which brings us to a really tough question, one that people are debating right now. Can an AI actually be fairer than a human? The potential is there, yeah, if we can spot and fix those biases in the data. But if we can't, we might just end up encoding our own human flaws into the very foundation of medicine's future. So, what does the future look like? Well, today, it's all about AI-powered diagnostics. In the very near future, you're going to see generative AI designing new drugs. Looking further out, we'll see things like federated learning, which can train AI models without ever compromising patient privacy. And the ultimate vision, the end goal? True AI-enabled precision medicine for every single one of us. Look, there is zero doubt that AI is already reshaping medicine as we know it. The government has its blueprint, the tech is moving at lightning speed, and the potential is just massive. So the only real question left is, are we ready for it?